So, what if you could take every single doctor in a country and, I don't know, multiply their impact? Sounds kind of like science fiction, right? Well, that is the huge goal of a new blueprint called MedCare. It aims to tackle Nigeria's massive healthcare crisis, and it's using the power of AI to do it. So, how on earth could a plan like this even get off the ground? Let's dive in and break it down.
Okay, so before we can even talk about the solution, we've got to wrap our heads around the problem itself. And I mean the sheer scale of it. We're not just talking about a challenge here. This is a full-blown crisis, and one that actually feeds on itself.
Just look at this number. One single doctor for every 3,500 people. Let that sink in. The World Health Organization says the minimum should be one for every 600. So this is nearly 6 times worse. This one statistic, right here, this is the epicenter of the whole crisis.
And this is where it gets really tricky. The problem isn't just a shortage, it's a vicious cycle. You see, when you have so few doctors, they get completely overworked and burned out. And what happens when you're burned out? Well, a lot of them leave the country, which of course makes the original shortage even worse. It's this reinforcing loop that just keeps getting tighter and tighter, and it's incredibly hard to break out of. You know, it's easy to talk about systems and loops, but this isn't some abstract problem. This translates into real, everyday human suffering. I want you to just imagine this for a second. You're sick, maybe your kid is sick, and you have to wait an entire workday, 8 hours, just to see a doctor. And after all that, you get less than 5 minutes of their time. For millions of people, this isn't an exaggeration. This is their reality. And the impact? It's just staggering on every single level. Get this, 60%, more than half of people in underserved areas say they've never seen a doctor. Ever. And on the flip side, the crisis is so bad that it's actually draining $2 billion from the economy every year because anyone who has the money is forced to go abroad just to get decent medical care.
Okay, so things sound pretty bleak. But, you know, sometimes in the middle of a really deep crisis, you find a moment for a breakthrough. So what if this perfect storm of problems has actually created the perfect conditions for a completely revolutionary solution?
It turns out there are 3 key things all coming together at the exact same time. First, you've got the healthcare crisis at its absolute peak, which means the demand for a solution is urgent. Second, the digital infrastructure is actually there and ready to go. We're talking over 140 million smartphone users. And third, there's a huge market gap. No one has built a single platform that pulls all the necessary pieces together. And that is what they're calling the MedCare opportunity.
All right, so what is MedCare exactly? Well, think of it as a single, unified platform. It's designed to amplify the healthcare system's capacity right from the ground up.
The whole thing is built on 3 core pillars that all work together. First up, you've got an AI triage hub to get patients to doctors way more efficiently. Second, a predictive e-pharmacy to make sure the medicine you need is actually in stock. And third, data-driven mobile units to bring physical care to places that have been completely cut off, what they call healthcare deserts.
Okay, let's break these down. Pillar number 1. This one goes right after the biggest bottleneck in the whole system. If you want to fix that long, agonizing wait time, you have to find a way to bring some order to all that chaos.
So, here's the magic. An AI chatbot, one that's localized for the region, handles all the initial intake stuff. It gathers your medical history, asks about your symptoms, and prioritizes cases. Just doing that can cut a doctor's admin work by up to 40%. This frees them up to do what they're actually trained to do, diagnose and provide care. And the result? That 8-hour wait for a prescription gets slashed to under 45 minutes. That's a game changer.
All right, so you've seen the doctor, you've got your prescription, but what about the actual medicine? We've all been there, right? You go to the pharmacy and they're out of stock. Well, the second pillar is designed to put an end to that exact frustration.
And this part is really smart. The platform takes all the real-time data from consultations and feeds it into machine learning algorithms. These algorithms can then actually forecast the demand for specific medications, right down to the location. Then it alerts partner pharmacies so they can stock up before they run out. And to top it off, it uses logistics tech to get that medicine delivered to you, same day or next day.
Okay, on to pillar number 3. This is where technology builds a bridge, a literal bridge, in a way, over that physical gap in healthcare, bringing it directly to the communities that have been totally left behind.
And this is where all that data becomes incredibly powerful. The platform gathers anonymized data to spot clusters of unmet medical needs. It uses something called a geospatial AI, which is just a fancy way of saying a system that analyzes health data based on where people live. And it combines that with public health records to create a dynamic map of these healthcare deserts. Then, it directs solar-powered mobile clinics right to those spots to provide things like vaccinations, antenatal care, and diagnostics. It's about bringing the care to the people, not the other way around.
So we've got these three big pillars. Let's put it all together now and ask the most important question. What does this actually feel like for a patient? You know, the person who's actually sick and needs help.
The whole point is to change the experience from, frustrating and exhausting to something that's seamless and respectful. It starts with a simple AI symptom checker on your phone. Then, you get connected to a real, licensed doctor who already has all your initial info. The doctor gives you a digital prescription or a lab request, and boom, the final step is your medication arriving via a tracked delivery. And here's a little peek at what it looks like. On the left, that's the simple chat interface where the whole journey kicks off. And over on the right, that's your personal dashboard. It's where you can manage everything: appointments, prescriptions, your whole health history. It's all about putting you, the patient, back in the driver's seat. Okay, so the concept is amazing. But how do you take this from a great idea on a slide deck to a real, functioning national system? Because let's be honest, a great idea is one thing, but having a viable plan is something else entirely. Well, they've got a really clear, step-by-step roadmap. It all starts with a pilot program in Kaduna. The goal there is to serve over 3,000 patients and get that wait time under 30 minutes. Phase 2 is all about scaling up and learning as they go, expanding into more states. And then Phase 3, starting in year 2, is about hitting national sustainability and reaching 100,000 active users. It's a crawl, walk, run approach.
And look, for something like this to last, it has to be financially stable, right? It can't just rely on grants forever. So the model is built on 4 different revenue streams. You've got affordable subscriptions for patients, corporate health plans for businesses, logistics fees from the pharmacy side, and even partnerships using that anonymized data to help shape public health strategy.
And what's really crucial here is that they've actually thought about the roadblocks. They've planned for them. Worried about trust? All the doctors are licensed and all the data is encrypted. Worried about AI bias? The models are trained specifically on localized Nigerian data. And what about bad internet? Well, the app is designed to work offline first, and it even has a backup that uses basic text messaging, so it works on any phone, anywhere.
And that really gets to the heart of it, doesn't it? The ambition here is so much bigger than just building an app. What they're trying to do is create a whole new operating system for an entire nation's healthcare.
So, you've got a comprehensive plan. The technology is ready to go. And the need? Well, the need has never been greater. It really just leaves us with one massive question for the future. Can a system like this, a true healthcare operating system, actually transform the health and resilience of an entire nation?